Thank you. I just want to make it clear, the company is called Bynocs. Think about binocular vision. So I'm going to speak about remote management of adult amblyopia, and I have a financial interest. I'm the chairman of the Medical Advisory Board for Bynocs. So amblyopia or lazy eye is a condition of reduced visual acuity due to abnormal visual development. At least 300 million people affected worldwide. And the current standard of care is patching or penalization of the good eye. And the current treatments are ineffective in adults for many reasons. To date, they haven't worked in adults, but there's been poor compliance, residual amblyopia, recurrence of amblyopia, and deficits in stereopsis. So Bynocs, and this is an example of their program on the right, their dichoptic therapy is changing this. So dichoptic therapy works by, the brain perceives an image on the dominant eye when you're amblyopic and ignores the other image. And when you patch, all you do is you get an image on the suppressed eye. You get no binocularity. There's no stimulation of the binocular cells. But when you wear these duochrome glasses and your image is programmed to each eye, and now the contrast on the good eye is reduced to match the quality of the image on the amblyopic eye. So it's a partial, think about it as partial patching. It's not a revolutionary breakaway from the concept of patching, because people will have a problem trying to figure out how it's different from patching. But it's an advanced patching of part of the visual field while the second eye is open, so developing binocular vision. And with 2 images, you can have 3D vision. And you can go from being someone who's struggling to someone who's running with both eyes functioning. So clinical results, this is a study done in India, 161 subjects, mean age of 8. So this is in the pediatric population, just going past the stage where we think it really works. And you can see a very, very good increase in binocular vision and in number of lines improved, and in 30 sessions of half an hour, 5 days a week, weekends off, but 30 days to achieve this kind of improvement. And 90% of subjects developed or improved their fusion and stereopsis. We've seen the very same thing in our own clinic. These patients are between 15 and 65, so this is blue ocean territory. These are patients who before we'd say, there's nothing we can do for you. That's not the case anymore. So the market opportunity and the rest, the treatment, amblyopia treatment market is set to gain valuation of up to almost $6 billion by 2031, according to MarketScope. And Bynocs has a modest aim to capture 20% of that market. It's US FDA and CE registered. There's global intellectual property that's secured. And it's the only company currently treating adults with amblyopia successfully. There's an international team. You'll know many of these faces on the leadership team. And there's an international structure across the world. So, we had ACOS in Antwerp recently. One of the quotes from a top refractive surgeon was, a refractive surgeon, the biggest and most exciting innovation in ophthalmology today, this blue ocean space of getting the second eye to work. Adult amblyopes have gone from no hope to successful therapy in 6 weeks. It's the fastest and most significant permanent improvement in visual acuity, 3 to 6 lines in 6 weeks. It's the development for those who don't have it, or the restoration of 3D vision of those who might have had it. And there's a collaborative strategic model involves reducing eye care practitioners' clinical burden while improving revenue stream by expanding the market. So most of this work's happening remotely with a company. They see you twice in the clinic. And Bynocs is a thought leader in managing binocular vision in ophthalmology, including cataract, refractive, dry eye, pediatrics.